Well, so I wanted to ask because I was recently actually in a doctor's appointment with a man who, as he learned that he had HIV, and it was just really affecting for me to see how that news impacted him and his struggle to kind of deal with that diagnosis. I was wondering kind of how doctors these days communicate that to their patients, that you have HIV, but it's not a death sentence, or what do you tell people to encourage them to take medication, to encourage them to stay positive despite the diagnosis?
Well, I see a few patients whose diagnosis is brand new. I usually get referred patients who have already been diagnosed. But in our clinic, where we would make a diagnosis of a patient, and certainly back early on, how you address a patient today versus the 1980s is different. But if someone comes into an office now, you should never underestimate the emotional trauma that a person, even in an arena in which you have effective therapies. So you have to be realistic about what it is, but there's a lot of encouragement that you can give to patients. So you've got to be sensitive to the trauma that they have with this, which could be a life-altering situation for them. But then right now I find that patients really want to hear the details of what we know now about the virus, what we know about the projection of the drugs, what the toxicities of the drugs are. So it's an entirely different patient-physician interaction in 2017 than it was in 1985. I mean, just like day and night difference.
How is it different?
Well, it's different because, I mean, I have to say, I've written about this, that from 1981 to 1987 were the darkest years of my professional career, because you had to counsel people in what what the reality is, that things were really bad. You gave them encouragement about treating opportunistic infections. In 1987, when the first drug AZT was approved by the FDA, we had a blip of hope in that individuals who were essentially going downhill essentially did well, but for a limited period of time, because of a single drug with an RNA virus, you could predict you're going to have resistance. We tooted along to one or two drugs, and then when we got to 1996 and beyond, when we had the triple combination, first with protease inhibitors, but now with integrase inhibitors and others, it's much, much different, because you could project, like I said in the first question that you asked me, Olga, that you could tell a person to motivate them to take their drugs and to take good care of themselves, that they could actually live an essentially normal life. Now, the thing that's interesting, and I just want to throw this out, when people get complacent about infection by HIV because we have life-saving drugs, we've got to disabuse them like that. I don't know any of my now thousands of patients that I've seen who would rather be infected than uninfected. Yeah. So this idea that it's okay, we have great drugs, is just really a fallacy. It just is. So the most important thing, as we were talking about with PrEP, and doing everything we can to prevent infection, is absolutely critical. But when a person is infected, there are so many things that they can do to live a normal life. So it's a different dialogue that you have with the patient now than when you were facing almost a certain, if not a death sentence, certainly a lot of suffering and morbidity.